Hey YouTube, Andy Ditch here. So, so I want to share with you some of my my symptoms of interception, sensory differences. Okay, and I also don't know enough about that, to be able to go into details on it, so I will use this to help me express my thought and my point of view, and to help me communicate my symptoms. And I'll use this video because it seems like this person knows a lot about it, autism and the symptoms of autism, that I will go into this for you. And I'll use this as a tool to help me express myself and to be able to educate others, especially in a detailed topic about interoception. Is something that I don't know a lot about. It seems there's a lot to this deficit of autism. It seems like it's pretty common with autistic individuals. And while I talk to you about this, I will be going back and forth to my routine board, so that way there I can continue doing my routine. And one of the things I want to talk to you about my interception symptoms. So the way I am able to understand interception is what's going inside, what's happening inside of my body. What processes or nervous system, central nervous system symptoms are happening inside my body. Okay, it's a lot. It deals with body temperature, heart rate, your sweating, your ability to recognize your own emotions, your physical sense of awareness to your body being in pain, your being hungry or thirsty, urinating and pooping, and basically all kinds of things are part of this sensory processing issue. It explains why I don't have the awareness to feel the urge to pee or poo, or feel hungry or full or thirsty. If it explains why I could not feel when I had my back problem for years. I have been suffering from a back injury, according to my neurosurgeon, for years. That's why I had to wear a knee brace. Everybody thought it was for my knee because I was not complaining of my back. So you realize that is why I didn't realize my back was hurting me, because of my sensory processing issues. It goes along the lines why I need a diaper. It goes along the lines why I don't realize when I'm getting sensory overload. Why I'm not able to understand my triggers or warning signs. Why I don't have the ability to regulate my own emotions. This explains why. I'm gonna let my dogs in so they could eat. And I'm going to eat something as well.
Neurodivergent Nation. This is a Neurodivergent Doctor. My favorite comment that I've had of the week is, I look like a non-coked up Donald Trump Jr. And I think that's because it looks like I've always got slick backed hair in my, or gel in my hair. So today I kind of like brushed that out a little bit to make it not look so much. I'm not sure if that's a compliment or not. I'd probably go with no, but Maybe the non-coked out part is good. Anyway, my question to you is, are you a person who's always hot? Are you sweating profusely for seemingly no good reason? Do you strip down the moment you walk in the door and hope that your kid didn't bring some friend home that you didn't expect? Or maybe like I've been my whole life, where you're constantly cold and you can't seem to heat up. What about forgetting to eat all day, or being chronically dehydrated because you don't drink enough because you don't recognize that internal cue that tells you that you're thirsty? Are you one of those people who dresses wrong for the season, like shorts and t-shirts in 38-degree weather? It's right for you, but everybody else is like, why are you dressed like that?
I have these issues that he just talked about, and yes, I wear shorts, and sometimes I wear pants during the summer. It's hard for me to know what I need to dress. And I have trouble where I don't drink enough, where I tend to get dehydrated and not feel well.
If you've answered hell yeah to any of these, you may be having difficulty with one of your senses, but which one? So you've heard of the 5 senses. You know touch, taste, sight, hearing, and smell. And then there's our little 6th sense that our little friend Haley Joe Osmond taught us all about. He thought he saw dead people. No, I'm just kidding. That's not the real 6th sense. Well, it is the name of the movie, The 6th Sense, and I hope I didn't spoil that for anybody. But the real 6th sense is actually what's called our vestibular sense, which is all about balance and posture. But this video isn't about senses 1 through 6. It's not even about our 7th sense. I know this is like starting to sound like a Fast and Furious franchise, like F-19, the fasterest and the furiouserest. Outer space will never be the same. I'm tired of these two, believe me. But real quick though, our 7th sense, before I move on to the 8th sense, our 7th sense is proprioception, which is our ability to know where our body and our body parts are in the space around us. This is something I spend time with my clients talking about after diagnosis of autism. Someone who struggles with proprioception might constantly be bumping into things, have lots of bruises they don't even know where they came from, and difficulty knowing where their body parts are relative to their other body parts. So think tripping over your own feet or smacking your hip with your own arm. That's not what this video is about either. I know, get to the point already, right? But I will record a video on the 7th sense later. But today I wanted to talk about the 8th sense, which is interoception, and the problems a lot of our neurodivergent nation deals with. Basically, interoception is...
So, you guys want to say, oh, you never had sensory issues. Some people want to say that. I never had sensory issues in my life. Well, what do you call it when I have trouble with perception that causes me trouble with balance and trouble with where I get hit by cars and twist my ankle, and trouble with judgment and tripping over things and running into things? And what do you call it when I have trouble knowing when I gotta eat, or how much I gotta eat, or when to drink, or when I had to use the bathroom, or why I wear shorts all the time or pants all the time? Or, I have trouble with knowing, how I feel and how to regulate my own emotions. How can you guys sit here and say that this is something that's brand new to me? It's not. And that's where I just have another step in the direction that supports I have this disability that some people don't want to accept.
Is a person's conscious or non-conscious sense or awareness of what is going on inside their body. Interoception problems are not only having to do with things that I talked about at first, like body temperature regulation problems, not recognizing hunger, thirst, etc., but they might also...
So my body temperature tends to run on the cooler side. On average, my body temperature is around 97 degrees Fahrenheit. And that is a degree below normal. And actually, if you want to answer my question, you want me to answer another question about that, there are times that my internal body temperature measures at a hypothermia level. Yes, and I'm extremely sensitive to heat. and I sweat a lot.
Include issues like bladder control problems, extreme fatigue, difficulty properly interpreting emotions, and getting hurt or burned without noticing right away. And these are just a few examples, but that's not all. Check this out. It also has a hand in controlling your autonomic motor system, which is breathing, intestinal functions, blinking, heart rate, eye dilation, and more. No. I'm not done yet. Guess what? This is also the main mechanism for our fight or flight response system. So let that percolate in your mind just for a moment. Just process this. This is the main mechanism for our fight or flight response system. If you're having interoception problems, you're likely having problems controlling some or all of these functions I just mentioned. And you may be in states of panic and anxiety more often. And this may make you stand out to others, preventing you from going out in public places with confidence and ease. And it may play a role in so many other things that are common traits of autism. Wow. I mean, who knew so many issues could be tied to this one sense that never really gets talked about? Okay, so let's break this down into bite-sized chunks. You know, this is what I like to do. You see, we have sensory receptors throughout our body, in our muscles, in our skin, in our joints, even in our bones. And 90% of these are what is called free nerve endings, located in the outer flesh and skin. These pick up on sensations and send signals to our brain about them, and in turn, our brain figures out how to regulate many of our organs and functions, which keep us in a state of homeostasis, which is just a fancy word for balance within the body. Homeostasis helps us prepare ourselves for the day and helps us interact well with others. So for this video, we will call our body's attempts to prepare for homeostasis Preparation H.
Yeah, Herr Doctor, it's a really good plan.
Yes, Frau, on the whole, I think Preparation H feels good.
Please, for the love of good, somebody comment and finish this bit for me, please. Dr. Evil. Anyway, when a person has some challenges with their eighth sense, they can experience lower self-awareness, difficulty problem solving. Sounds like ADHD too, doesn't it? Challenges with looking at other people's perspectives, social understanding problems, cognitive inflexibility, trouble deciphering where feelings of empathy are coming from, and emotional recognition and regulation problems. A person might experience a rapid heart rate at inappropriate times. They might have heavy breathing at inappropriate times, which can be kind of awkward.
This explains why I had behavior issues. This explains why I have the behavior issues that everybody is scared of or don't understand why. This is also why I get hurt a lot. This is also why I have trouble crossing streets. This is also why I get so panicked. This is why I have a hard time understanding my social environment, social cues and things like that. This explains almost everything about why I have certain issues. And I just want you to know why does some people continue to think that I don't have anything wrong with me and that there's nothing that I need help with. If I have tics and stims because I can't feel the urge to pee poo and it's hard for me to manage my hygiene after I pee my poo myself, I guess it just makes sense to why I would need help. If I can't deal with sticking my finger because of my sensory issue to pain, I guess it makes sense why I have issues. When I have a hard time knowing that my back gets injured, I guess it kind of makes sense to why I would need somebody to take care of me and monitor my health so I don't get hurt or to prevent issues for me in the future. If this makes sense to you guys.
And wetting the bed at inappropriate times. Actually, this is a really huge problem for a lot of people, and I've worked with them in the past about this. On a personal note, and I'm being totally serious about this, I wet the bed until the age of 12, and I couldn't figure out why in the hell that was happening. No matter what strategy I used, even that little alarm bell thingy on my bed, it didn't work. It sucked. It was humiliating. It got in the way of my social life where I typically couldn't sleep over at friends' houses, and it was a way for my a-hole cousin to poke fun at me. F you, Ezekiel. Anyway, so what's the deal with autistic individuals and interoception? Why do so many have a problem with this, and how does it affect them? Why are some struggling with less while others experience more of it? Isn't that just like autism, though? Just when you think you've figured something out, half of the autistic people out there, they experience something different, just the opposite sometimes. That's one of the reasons it's so tough for neurotypical people to study autism and draw conclusions. Autism is a huge multidimensional phenomenon, and our understanding of it is just in its infancy. Another part about research on this subject of interoception is that it draws correlations fairly well, which means it's been identified that many autistic people experience diminished interoception, but they don't necessarily know why they experience it more often than the general population. There's also research that suggests that interoceptive awareness can actually be heightened when depression and anxiety are present. This means some autistic individuals who experience anxiety or depression or both may actually feel their internal cues more, which causes completely different types of problems. Now, let's talk about body temperature and regulation for a moment. Because this seemed to be a very common trait within our neurodiverse nation, when I put this on social media, it's something I think needs a lot more attention. Temperature regulation is supposed to be automatic, and it's supposed to change slightly depending on the ambient temperature around us. The temperature of the body is mostly regulated by information passed back and forth between the hypothalamus part of the brain and the skin. When your body is exposed to different temperatures, your body's using this system. It's supposed to balance your internal body temperature with temperatures outside of you. When the hypothalamus is unable to do its job effectively, then your body can overheat or be too chilled. Many autistic individuals have trouble with this because their body and brain are having a hard time picking up on that information. I'm talking about the information between the hypothalamus part of the brain and the skin. And as a result, they can experience higher or lower core body temperatures. This is usually associated with sensory processing issues, but as you see, this flavor of interoception plays a big role in autism. Autistic people may...
So I want to just add one more part to this. I am aware that I have this issue. I've always had this issue. It's why I need the air conditioner on at 60 degrees. I cannot cope with heat or humidity. I never could. I get very irritable when there's heat and humidity. Why? I don't know why. But explains why. But I did not a doctor to say this is a problem for me or not. Okay, I'm going to just add one more part to this. So I do have a genetic condition that has not yet been officially diagnosed because I have to see a special doctor for this. A geneticist or genetic counselor, whatever it's called. Okay, but a lot of my medical conditions could be related to one medical cause. My genetics. One of those genetic causes would be considered causing the autism. Yeah, I know it kind of sucks that I'm bringing up the idea that I have a genetic cause to this, but the reality is there, and it is possible that I have Phelan-McDermott syndrome, which is the genetic condition that I'm talking about. I learned how that affects the endocrine system. I learned how pituitary cysts are common with this condition. Okay, I have a pituitary cyst. Okay. I learned how the pituitary cyst can cause issues around the hypothalamus, whatever it's called. I'm not even pronouncing it right, I know. I have a hard time pronouncing words, especially new words. And I understand that. because the pituitary cyst is around that area. I also am aware that my pituitary cyst was talked about as being quite large and affecting my brain, but I had two doctors, both Dr. Benedict and Dr. Stone, who reviewed the MRI, who both said there is no major cause of concern for my pituitary cyst. It's not large, it's not small, it's there, but it's not affecting me like neurology doctors had talked about. So that's good news. Yet again, another issue why neurology is not something I kind of like going to, because they misdiagnosed me, they misdiagnosed my mom, and they basically, don't want to treat me, but yet they're the ones who made this diagnosis and put panic in me because of this. So anyways, long story short, I just want you to know that this is what are the big issues that I want you to be aware of, that having a pituitary issue can also cause, or the Phelan-McDermid syndrome can also cause problems regulating body temperature. So it's not just autism that could be causing this issue. Matter of fact, Phelan-McDermid syndrome could also be causing my overproduction of urine and overproduction of sweat. That could be adding to the symptoms of heat regulation, lower body temperature, and faster heartbeat. I bet you guys did not know that. Phelan-McDermid syndrome also can affect the kidneys, the heart, which I have been told I do not have any heart issues. I do not know anything about kidney, because I've never seen a kidney doctor. But I have a lot of GI problems. I do have a lot of autoimmune issues, such as the HS, which is the skin issue, the irritable bowel syndrome, autoimmune type, and that's the constipation type I have. And then there's the other thing, my anemia has also been ruled as being autoimmune type, just to let you know as well. Forgot what else I have autoimmune. Autoimmune hypothyroidism called Hashimoto. There's another one I forgot. I have a list of diagnoses. So guys, these are some of the things that the autoimmune issue may be also linked to causing the diabetes issue as well, and the endocrine issues. So we now know that is a common trait with autism, not just Phelan-McDermid syndrome. I also have multiple other, issues when it comes to, my problems with my day-to-day life with autism, and, I just want you to realize that this is something that's not brand new for me.
They constantly run hot or cold, or may not feel pain as much, or can't tell when they're fatigued because their body's not processing that information well. It can also give the wrong sensations, such as numbness or itching instead of pain, or vice versa. A simple bug bite that itches can cause pain for some, and this can be very confusing to an autistic individual, especially as a child. So think about this for a second. When an autistic child is learning to label their feelings, so you're just a young one, you're learning what this feeling is, and people are putting labels on it for you, emotions, sensations, all those things. They're trying to figure out how their body works based on their experience and what adults are telling them. And if they are experiencing pain instead of itch, or tickle instead of pain, it might not match up with what the adults are telling them that they're experiencing. And that can be both confusing and frustrating for everyone. So it won't be until they're older that they figure these things out, like the difference between pain and a tickle, or the slight breeze on the back of the neck for most people is refreshing, but it causes pain in them. Parents have to really work hard to be aware of what their child is emoting and saying, and should be constantly assessing whether it matches up to what they're being told by adults. If they feel pain with being exposed to cold, Don't tell them they're feeling something different. Really try hard to figure this one out with them and correctly label what they're feeling. Now let's talk about emotions. Maybe you're one of the ones who can really feel emotions well. Anxiety, for example, it's usually pretty easy to recognize because it has a host of physical reactions that accompany it, such as having pupils dilated, increased breathing, muscle tension, and sweating. Some people say they get a gut feeling from certain people that warn them that the person's going to harm them or take advantage of them. They say that it feels like an uneasy feeling, and they usually point to this area, the stomach and the chest area. For those who struggle with interoception, they may not associate those sensations with anxiety or distrust, and they may not really associate it with any labeled feeling or emotion, and as a result, they may find themselves in really tough situations. I often hear autistic individuals complain that everyone accuses them of being angry all the time. But how frustrating might it be to be in a body that's constantly providing not enough or too much feedback for the situation that they're in? They may not be aware of their facial expressions, their vocal tone, their volume, and their stance. They may appear to be angry from the onlooker's perspective and experience. But think about this. If you're constantly being told that you're angry, wouldn't that actually begin to really make you angry? I mean, honestly. Anyway, my point is, a lot of individuals, they may misinterpret their sensations, or they may not feel them at all. One of the big downsides to this is when a person is experiencing something inside and does not respond to it in a way that helps them deal with it. It can build and build and build, adding to other sensory issues that they might be having, adding to the stress associated with being autistic in a dysfunctional world, adding to the physical and emotional problems that come with sleep problems and work stressors and yada, yada, yada. Add these up and we have all the makings for a blow up or a meltdown or a shutdown. Too many of those can result in an autistic burnout, and you can check out my video on autistic burnout on here as well. I remember this one time. My wife was distracted while she was cooking, and she pulled a pizza pan out of the oven while it was super piping hot and felt no pain. Conversely, when she gets sick, she has a hard time telling where she's feeling bad. She just knows she feels bad, and she feels it very intensely. Now, as a caring husband, I try to communicate with her in the best way I know how to help her figure out what's going on and determine if she needs medical attention. But this can be difficult because most autistic people hate rapid-fire questions or any questions at all. And my ADHD ASD ass just wants to ask questions while my brain goes into hyperfocus on the challenge of solving this medical mystery like I'm House MD or the Good Doctor or something like that. I need to have a personal time. No. Another personal example, myself and two of my sons can go.
So I want to add one more part to this. So he talked about how autistic people ask questions, or ADHD people ask questions over and over again. My brother and dad absolutely hates me asking questions, but that's just part of who I am. I don't know why they get so upset with me when it's nothing new with me, you know? But anyways, I just wanted to throw that in there, that is part of what something I deal with every day and how it affects other people. And my sensory issues just adds to my level of functioning in society. That causes me a lot of panic and frustration and confusion. And it really overwhelms me to the point where I have a hard time going out in public. And earlier I heard in him talk about, I heard the doctor talking about, I forgot his name by the way, that depression and anxiety can add to sensory processing issues. So I think this will be a time that I can think of adding to what he had said there. Because I actually struggle with that part of my day-to-day life as well. And one of the things that I want to talk to you about, it's not that I have like a depressive disorder, like I'm mentally ill. It's my environment that causes me the depression. It's feeling bad about how people treat me and how I'm being misunderstood. Being not understood is extremely difficult for me because that is one of the things that I feel people have this big misconnection with me. I feel never understood by people. I feel like I'm so different that people are like not wanting to socialize with me. And because of that difference and misunderstanding, I feel that people tend to not want to talk to me because of that, which adds to the loneliness, which adds to the social anxiety and the fear of rejection and the fear of my behavior issues that I have. And then that adds to even more to the symptoms that I have every single day. And then to top that one off, right? It not only adds to those symptoms, but it also adds to the behavior traits that I have issues with. Far as the behaviors that I have and the functioning issues that I have. And, the way that these behaviors affect my day-to-day life really affects other people, and it causes me more depression. And then I set myself up to be name-called and criticized and blamed, and people then use as excuses for their actions for why they didn't do something to help me, or why they did something but didn't do this, and it causes me this even more frustration and confusion and depression and anxiety all in one package. And that really is something that I deal with on a day-to-day basis that adds to my inability to cope with change, inability to cope with my sensory issues. And I feel maybe that could be why I have a lot more harder time controlling my bladder and bowels, even though I never had full control over them. And I never had any control over my bladder to begin with. I always needed a routine. But even without having these issues, my bladder has never been, something that I have been symptom-free of. I've always had symptoms of my bladder. And even with the routine and not having depression or anxiety in my day, I still always had access even with the toilet routine. So this just adds to some of the emotional issues when I'm constantly made fun of or criticized for having accidents and not being able to help it. And then, of course, I want to throw out my diapers, rip up my diapers, and not get the autism testing because why bother when I'm not going to get any help for my autism and all this other stuff.
All day without eating and not even think about it. That's likely interoception hyposensitivity. All right, so if you've seen my videos, you know I like to provide hopefully helpful information on autism and ADHD that nobody else is providing, because not only am I multiple levels of neurodivergent, but so is my wife and my family. But I'm also a doctor of clinical psychology and a clinician and a researcher, and I test people for autism. But for me, telling people about this is great. But I also like to provide tips and help to people in hopes that it will help you in your neurodivergent life. And this video is no exception. So here are some ways that you can improve your interoceptive awareness so that you can improve your experience in life. Number one, there are no tests out there that I'm aware of that test interoception. There is a questionnaire that's intended to help you identify the degree of interoceptive awareness that you might have, and this is called the MAIA assessment. It's a short assessment, and even though it was not normed on an autistic population, it might be pretty good at helping you determine where you are on this. I, along with my people at my clinic, completed the MAIA, but we were confused on how we compared to the general population that we presumed it was normed on. After scratching our heads for a while, I reached out to the clinic and was able to talk with the person who created this questionnaire. They said the tool has no norms, but he said that it's more for you to assess yourself by asking questions related to interoceptive awareness. So good news. The MAIA did just that. It was able to reflect on my experiences related to interoception, and that was helpful. So number one is check out the MAIA test if you want to. It's free, it's online, just Google it. Number two, I'm a huge fan of mindfulness, which is another word for a type of meditation. What I'm talking about is choosing a part of your body, any part, and just wiggle that body part around while you focus on what it feels like. When you're done wiggling, just lay there and notice what that body part feels like. I love being mindful after a yoga pose or a workout. Wow, it's hot in here. Holy crap. This really works. It's easy, but don't let the simplicity of it throw you off. Try it out for a few minutes, for a few days, and see if it makes you feel different and more interoceptively aware. Number three, another way to practice some mindfulness is to get a notebook and write down what your body experienced during that mindfulness wiggling. Write down whatever you're feeling, what you felt like beforehand, what you felt like during and after. Writing it down forces you to make more accurate connections in your mind between the body and your cognition. Describe what you feel in as much detail as you can. Number four, biofeedback. Now, biofeedback is a therapeutic technique that uses technology like sensors that are attached to the body to provide visual information about various bodily functions such as heart rate, breathing, etc. It helps connect the brain and body. Researchers have posited that just 20 minutes of biofeedback drastically improve interoceptive accuracy in test subjects. Number five, brain stimulation. This is another technique that can improve interoception. This one can range from being minimally invasive to pretty damn invasive, depending on the type. It can also run on the expensive side and can be quite a time commitment, but be that as it may, various forms of brain stimulation have been shown to manipulate the brain's signal processing responsible for interoception. Number six, there's a book by Kelly Mahler called Interoception, the Eighth Sensory System. It gives details about how autistic individuals can improve body awareness. Kelly is a licensed occupational therapist, a researcher, and a professor, so it might be something to consider reading. Number seven, have you heard of a sensory diet? It's nothing to do with food, really. It's a carefully designed set of sensory experiences that help a person learn body awareness. There are so many things you can do to learn about your own body and senses, such as sand play, hair brushing, exploring different textures on cloth, different foods, hot tub, cold showers, letting glue dry on the fingers and then peeling it off, vibrating things, weighted blankets, massages, etc. Number eight, and this just isn't for interoception. This is a skill I want to talk to you about that will serve you in every area of life. Number eight, now this is one that can actually be generalized to your entire life. Like this is a very important skill. Teach your partner or loved ones who have a lot of contact with you the art of additive empathy. When you're having difficulty expressing your emotions or identifying your physical or mental state, someone skilled in additive empathy can make statements about what they feel might be going on with you. Here's an example. Let's say you're in the car and you're starting to breathe heavily and you start tugging or adjusting your clothing. Some people would say, "What's wrong with you?" Or "Are you okay?" Or "Stop freaking out." Someone using additive empathy might make a statement such as, "I'm getting the impression that you're hot and that coat might feel restrictive." See, it doesn't have to be a question. Because what do most autistic friends I have say about being asked questions? Yeah, they don't like them. So additive empathy is often a statement. If you're wrong, generally they can correct you with what's going on, hopefully. Try looking up additive empathy. Maybe try it out on yourself. It's a great tool for effective communication, but you can help others learn it too. Help them help you. Jerry Maguire. Help me, help.
So I want to quickly go into this a little bit. So he talked about mindfulness. I'm going to have to try doing that exercise of wiggling a body part and for a few minutes and see how it feels and then stop. The other ones in here is I didn't realize that. Here, let's go back.
Tugging or adjusting your clothing. state every area of life. Vibrating things, body and senses. Can improve body for can also run on the feedback. Feedback is a therapeutic technique that uses technology like sensors that are attached to the body to provide visual information about various bodily functions such as heart rate, breathing, etc. It helps connect the brain and body. Researchers have posited that just 20 minutes of biofeedback drastically improve interoceptive accuracy in test subjects. Number 5, brain stimulation.
Okay, so I want to talk to you about biofeedback. So I've been told biofeedback is something that can help with urinary incontinence with autism, and even, interception issues and that kind of stuff. I've been asking about it with my urologists and doctors for a number of years. Okay, it's something I really want to be able to know. It also can help with autistic emotional regulation. It also can help with the, processing of your environment and stuff like that. It's also very good for you to actually experience this kind of therapy when socializing with someone, because you could be more there are ways that they could teach you to be more aware of your environment and social environmental cues and stuff. And then the brain stimulation part is another topic that I've heard that could help with urinary incontinence and also sensory processing issues. And what are the big ones that they use for brain stimulation and urinary incontinence is putting a pacemaker-like device connected to a nerve that's in your butt on both sides that can help you feel the urge to go and be more regular. I am not a candidate for that. It's basically what I think the one report says on my urology assessment. I don't know. But I also know I'm not a candidate for Botox either, which is
on the expensive side and can be quite a time commitment. But be that as it may, various forms of brain stimulation have been shown to manipulate the brain's signal processing responsible for interoception. Number 6, there's a book by Kelly Mahler called Interoception, the 8th Sensory System. It gives details about how autistic individuals can improve body awareness. Kelly is a licensed occupational therapist, a researcher, and a professor, so it might be something to consider reading. Number 7, have you heard of a sensory diet? It's nothing to do with food, really. It's a...
So I've already I do this a lot already in stores. I go around smelling different flowers, different candles, going touching different fabrics, going looking at different colors around me at Walmart just to help me cope being in there. Okay, I also go around doing that in my everyday life. That's why I carry around my teddy bear. It's why I like those soft, spiky fidget toys and things.
Carefully designed set of sensory experiences that help a person learn body awareness. There are so many things you can do to learn about your own body and senses, such as sand play, hair brushing, exploring different textures on cloth, different foods, hot tub, cold showers, letting glue dry on the fingers and then peeling it off, vibrating things, weighted blankets, massages, etc. Number 8, and this just isn't for interoception. This is a skill I want to talk to you about that will serve you in every area of life. Number 8. Now, this is one that can actually be generalized to your entire life. Like, this is a very important skill. Teach your partner or loved ones who have a lot of contact with you the art of additive empathy. When you're having difficulty expressing your emotions or identifying your physical or mental state, someone skilled in additive empathy can make statements about what they feel might be going on with you. Here's an example. Let's say you're in the car and you're starting to breathe heavily and you start tugging or adjusting your clothing. Some people would say, "What's wrong with you?" Or "Are you okay?" Or "Stop freaking out." Someone using additive empathy might make a statement such as, "I'm getting the impression that you're hot and that coat might feel restrictive." See, it doesn't have to be a question, because what do most autistic friends I have say about being asked questions? Yeah, they don't like them. So additive empathy is often a statement. If you're wrong, generally they can correct you with what's going on.
So yeah, I like to just add the part to you guys that when my dad says, "Oh, you're yelling, you're talking fast, or your arm flapping more, I think you're upset, let's take a little break." That is very helpful when my dad actually helps me with that. Very helpful. It helps me be aware of what I'm doing and why I may be upset. It really helps me be able to, when my dad even adds a trigger to what happens when I do that. You're talking about autism, Andy. You're getting upset because your arm flapping and you're talking louder and faster. I think it's time to take a little break. Yeah, I think my dad is very helpful when he adds input like that to help me be more aware of my behavior and what's causing the behavior and what's causing the emotion or what I'm actually feeling. And it is something that I really, really need help with going with redirecting me to going to my underneath my weighted blanket and hugging my teddy bear or listening to music, playing a game of chess. Guys, this is something that my dad is not consistent with helping me with. And these are statements that have helped me, that my dad did last year a few times, that really helped me, but then he stopped. But then he learned that I need to be helped with what he's feeling and doing, and when he's going to be able to help me and redirect me to doing something else while I wait for his help. That has been helpful. That he's been more consistent with that one. It all goes back down to the idea of people understanding autism and learning about it before they can accept the diagnosis or the person, and then their differences, and then they can provide the support and assistance that that person needs, and then they can learn to include the person. Then they can learn to enjoy the person that has this disability called autism or intellectual disability, and then they can learn to include that person because they're enjoying them more. It all starts with a fundamental of learning to understand the disability and about the person and what causes certain behaviors, because we do have trouble with controlling with how we act and behave and communicate and interact and process and think and talk, that really causes other people to see us being different or stupid or odd or crazy when we're actually just autistic. I hope this really helps you guys to be able to understand our behavior so you could better be able to relate to autistic individuals or intellectually disabled individuals or even people with ADHD or other developmental disorders. Thank you and have a great day. My hope is that this is something that I can help you guys not only educate you about me, but also educate you about other people. And I highly recommend you guys subscribing to Neurodivergent Doctor on YouTube. Thank you. Have a great one, because he's done a lot of work to be able to help me express myself like other autistic people in their videos and stuff. And yes, I highly recommend it. Have a great one.